Welcome to today's lecture. Today we will be studying about the rectum. The rectum is dilated part of the large intestine which lies in between the rectosigmoid and the anorectal junction. In Latin, the word rectum means "and straight tube." So the rectum is straight in quadrupeds but not in humans because the anorectal junction is pulled forwards by the puborectal sling. Although the rectum is a part of the large intestine, it is devoid of its certain features like absence of tinea coli, appendices epiploiky, as well as the hostrations or the saculations. So in this slide what you can see, this entire thing is the large intestine. So you are having here, this is a cecum, this is the ascending colon, transverse colon, descending colon, here sigmoid colon, this is the rectum and this is the anal canal. So today we are just studying about this portion, that is the rectum. So you can observe that the rectum, even though it is a part of this large intestine, few of its features it is missing over here. So what you can see, so this is the tinea coli, that is the longitudinal band of muscle fibers. Then what you can see, these are the fat filled pockets and they are called the appendices epiploiky. Then also you can see here, all these are like saccules. They are called as saculations or hostrations. So in rectum, all these features are absent. In this section, what you can see, so here this is the rectum. So what you can see over here, these are the sacral vertebra along with the coccygeal vertebra. So you can see here 1, 2, 3, 4 and 5. All these are 5 sacral vertebra which are fused together to form an sacrum, and these 3 are the coccygeal vertebra which fuse to form the coccyx. So coming to the situation of the rectum, it is situated in the posterior part of the lesser pelvis in front of the lower 3 pieces of the sacral vertebra. So these 3 are the lower 3 pieces of the sacral vertebra and the coccyx, and behind the urinary bladder in the male. So this is the female pelvis. So here what you can see, this is the urinary bladder, this is the uterus, this is the rectum. So here also you can see it is lying in front of the lower 3 sacral vertebra and the coccygeal vertebra, and behind it is lying behind the uterus. So this is the uterus, the rectum is lying behind the uterus. Now coming to the extent of the rectum, so it begins at a continuation of the sigmoid colon. So this is a sigmoid colon, it is beginning as a continuation of it at the level of the 3rd sacral vertebra. The rectosigmoid junction is indicated by the lower end of the sigmoid mesocolon. Then the rectum ends by becoming continuous with the anal canal at the anorectal junction, which is lying 2 to 3 centimeter in front and a little below the tip of the coccyx. So this is the coccyx. So 2 to 3 centimeters below and in front of it will be the anorectal junction, where the rectum ends and the anal canal begins. In males, this anorectal junction corresponds with the apex of the prostate gland. So this is the prostate gland in males. So apex of the prostate gland will correspond to the anorectal junction. Now coming to the dimensions of this rectum. So the rectum is 5 inches or 12 centimeters in length. So if you see this length of this rectum, it is 5 inches or 12 centimeters. Whereas if you see the diameter of this rectum, so in the upper part, the diameter is 4 centimeters, and in the lower part, it forms an dilatation and it is called the rectal ampulla. So the diameter is not uniform throughout. Now coming to the direction and course of the rectum. The rectum at the beginning and where it ends, it is lying in the median plane. The rectum can be divided into upper 1/3, middle 1/3 and lower 1/3. The upper 1/3 of rectum is directed downwards and backwards. The middle 1/3 is directed vertically downwards, whereas the lower 1/3 is directed downwards and forwards. The rectum presents the curvatures or flexures in both, that is the antero-posterior and the lateral planes. So there are 2 antero-posterior curvatures and 3 lateral curvatures. So in this picture what you can see, so this is showing the antero-posterior curvature and this picture is showing the lateral curvatures. So now coming to this antero-posterior curvatures, so this is the anterior whereas this side is the posterior. So in antero-posterior curvatures, you are having 2 curvatures. So one, an upper curvature, that is called the sacral curvature, as well as the lower curvature which is called the perineal curvature. So the sacral curvature, it corresponds to the concavity of the sacrum and the coccyx which would be present here. So this sacral curvature, if you see, it is convex backwards. Just remember, all the terms which I use related to the curvatures would be like convex. So that will prevent confusions. So now coming to the perineal curvature, so it is convex forwards at the anorectal junction which is maintained by the puborectal sling. So the sacral curvature is convex backwards, whereas the perineal curvature is convex forwards. So now coming to the lateral curvatures, which are 3 in number. So so this is the left side, this is the right side. So you are having one curvature towards the left, whereas 2 lateral curvatures towards the right. So the upper lateral curvature, what you can see, it is convex to the right. It is present at the junction of the 3rd and 4th sacral vertebra. Now coming to the middle lateral curvature, it is convex to the left. So it is present at the sacrococcygeal junction. It is the most prominent curvature which you can see. Then the 3rd curvature, what you can see, that is the lower lateral curvature which is present in the right side. So this is present at the tip of the coccyx. So all the curvatures I have explained by telling the convexity. Like you saw the antero-posterior curvature. So that is the sacral curvature is convex backwards. Perineal curvature is convex forwards. Whereas the lateral curvatures, that is the upper right curvature as well as the lower right curvature, is convex towards the right side, and the middle left curvature is convex towards the left side. This slide is going to show you the peritoneal relations of the rectum. So the upper 1/3 of the rectum is covered with peritoneum in front as well as in the sides. The middle 1/3 is covered only in the front, whereas the lower 1/3 of the rectum, you can see it is devoid of peritoneum. So here also you can see this is in the upper 1/3. So in the front as well as in the sides, it is covered by peritoneum. In the middle 1/3 only in the front, whereas in the lower 1/3 it is devoid of peritoneum. Now coming to the visceral relations. Now in this picture you are seeing the male pelvis. So the anterior visceral relation of the rectum in males. So this rectum, so if you see the upper 2/3 of the rectum, it is related anteriorly to the rectovesical pouch. So between the rectum and the urinary bladder, the pouch what is formed over here, it is the rectovesical pouch. Then it is also related to the coils of intestine as well as the sigmoid colon. In males, the lower 1/3 of the rectum is related anteriorly to the base of the urinary bladder. So this is a bladder. So it is related to the base of the urinary bladder and also to the terminal part of the urethus, seminal vesicles, vas deferens as well as the prostate. So this is the female pelvis. So here what you can see, the anterior visceral relations of the rectum. So the upper 2/3 of the rectum in females is related anteriorly to the pouch that is called the rectouterine pouch. So this is the rectum, this is the uterus. So the pouch what is present here is the rectouterine pouch. Then along with this, other structures which are related anteriorly are the coils of intestine as well as the sigmoid colon. Then the lower 1/3 of rectum anteriorly in females, it is related to the lower part of the vagina. So this is the vagina, the lower part of vagina, it is related. Posteriorly, the relations are same in males as well as in females. So in posteriorly, along the midline, so or near the midline, the structures what is related, you can see lower 3 pieces of the sacrum, along with the coccyx, then the anococcygeal raphe, then the ganglion impar, then the median sacral vessel, then the superior rectal artery. So the superior rectal artery will lie opposite to S3 vertebra. Then also the fascia of Waldeyer, Waldeyer. So this fascia of Waldeyer is the connective tissue by which the rectum, that is the ampulla part of rectum, is attached to the sacrum and coccyx. On each side of the midline, if you see, the rectum is related to the muscles. So this muscle, that is the piriformis muscle, coccygeus muscle, then also you will be having the levator ani muscle. Then you are having the sympathetic chains. So what is present over here? So these are the sympathetic chains. Then the lower part of the sacral plexus, then the pelvic splanchnic nerve, then the lateral sacral vessels. Coming to the interior of the rectum, the mucous membrane of the empty rectum shows 2 types of folds. One is longitudinal fold, second is transverse fold. The longitudinal folds are the temporary folds which would lie at the lower end of the rectum. These longitudinal folds would disappear when the rectum become distended. The transverse or the horizontal folds are the permanent folds. So these folds are also called as Houston valves. Houston''s, Houston's valves. So this picture is showing you the transverse or the horizontal permanent folds. So these folds are called the Houston valves. So these are the semilunar shaped folds which are situated against the concavities of the lateral curvatures of the rectum. So they become more prominent when the rectum becomes distended. It has been named from above downwards. So these transverse folds or these Houston's walls are being named from above downwards. So they are actually 3 in number. 2 are on the left side and 1 is on the right side. Now coming to the first transverse fold or the first Houston wall. So it is situated close to the rectosigmoid junction. It projects from the right or from the left wall. It is situated opposite to the S3 vertebra and lies about 12 to 14 centimeters above the anus. Now coming to the second transverse fold or the second Houston wall. So it is the largest and most constant wall. It lies at the upper end of the rectal ampulla and projects from the anterior and the right walls. So it is situated opposite to the fifth sacral vertebra, 5 centimeters above the anus. So you saw the first wall was situated 12 to 14 centimeter above the anus, whereas the second wall is situated 5 centimeters above the anus. Sometimes the second wall encircles the rectum, and in such a case the circular muscle of the wall is known as Nelaton's sphincter. Nelaton apostrophe S, Nelaton's spincter. Now coming to the third wall. So this is the third transverse fold or the third Houston wall. So it is inconstant wall. So other two walls are constant walls, whereas this is an inconstant wall. So the second wall was lying around 12 to 14 centimeters above the anus, whereas this wall is lying just 2.5 centimeters below the second wall. It arises from the left wall of the rectum along the concavity of the lower lateral curve. Then one thing what you're supposed to know is that few authors also tell that there is another inconstant wall which is present in between the first wall and the second wall. So in such a case, if there is another wall which is present in between this first and the second wall, then the total number of walls would increase from 3 to 4 in number. As of now, just remember this first wall as well as the second wall are the constant wall, whereas this third wall is inconstant wall, and another wall can be present in between the first and the second wall, which would also be inconstant. Then in this picture, it is just the diagrammatic representation which is just showing the first wall, second wall as well as the third wall. Then the function of these walls is that they provide the support to hold the feces and prevent the excessive distension of the rectal ampulla. Now coming to the arterial supply to the rectum. So the rectum is supplied by the following arteries. So first is the superior rectal artery, second middle rectal artery, third is the inferior rectal artery, and also fourth is the median sacral artery. So this superior rectal artery is a continuation from the inferior mesenteric artery. This middle rectal artery is a branch from the internal iliac artery, whereas the inferior rectal artery is a branch from internal pudendal artery. Then the median sacral artery, which you are not seeing in the slide, so that is a branch from the abdominal aorta. Now coming to the venous drainage. So the venous draining the rectum, first it is the superior rectal vein, second middle rectal vein, third inferior rectal vein, and in some cases some authors also tell the median sacral vein. Now coming to the lymphatic drainage. So the upper part of the rectum is draining into the inferior mesenteric nodes. Then the lower part of the rectum is draining into the internal iliac nodes. Now coming to the nerve supply, the rectum is supplied by both sympathetic as well as parasympathetic nerve fibers. The sympathetic fibers are derived from L1 and L2 segments of the spinal cord. The parasympathetic fibers are derived from S2, S3 and S4 segments of the spinal cord. Coming to the supports of the rectum. So first is pelvic diaphragm. The levator ani muscle plays an important role for this. Second is puborectal sling, which surrounds at the anorectal junction fascia of Waldeyer. It attaches the lower part of the rectal ampulla to the sacrum. Fourth is lateral ligaments of the rectum, which are formed by the condensation of the pelvic fascia on each side. Fifth is rectovesical fascia of Denon Villiers, DENONVILLIERS. It extends from the rectum behind up to the seminal vesicles and the prostate in the front. Sixth is pelvic peritoneum. Seventh is pelvirectal and istiorectal fat. And eighth is perineal body. Coming to clinical importance, first is you are having rectal prolapse. So in this, the rectum is protruded through the anus. So it can be either complete prolapse or incomplete prolapse. In incomplete prolapse, the rectal mucosa will protrude through the anus when there is severe straining. Whereas in complete prolapse, the rectal wall itself will protrude through the anus. Second is digital perrectal examination. So this is done in many of the clinical conditions. So here it is done if there is any growth in the rectum, if there is any hemorrhoids or if any strictures or in any other condition. Third is proctoscopy. So here to visualize the interior of a rectum using certain instruments. Fourth is rectal incontinence. Damage to the anorectal ring would lead to incontinence of the rectum. Next is rectal fistula. So here there would be an blind tract which would open at two ends. So from the rectum, instead of it passing through the anal canal, it can either there can be a tract which is formed which enters and opens into the urethra or vagina or the urinary bladder. So it is called the rectourethral or rectovaginal or the rectovesical fistula. Thank you for watching.